Yeah, let's not return to pics like these. Here are top 5 viruses of 2026 to watch for, how to test, and simple ways to protect your family. Your quick, trusted guide. No fluff, just facts. Winter gatherings bring us close and help germs spread. Close contact passes viruses through coughs, sneezes, and surfaces. Colder weather keeps us indoors. Winter illnesses rise. More coughs and colds now. It's not a coincidence. Know how viruses spread to protect your family. Clear steps, not fear, to guide decisions. Let's cover the top 5 now. 1. Influenza. The flu. The flu spreads easily through coughs, sneezes, and close contact, especially during winter. Symptoms: fever or chills, cough and sore throat, body aches, fatigue, headache, and sometimes vomiting or diarrhea in kids. Flu is often treated with antiviral medications like Tamiflu, especially if caught early, plus rest, fluids, and fever reducers. Doctors use rapid flu tests or PCR tests from a nasal swab. Flu hospitalizations rise every winter, especially during holiday travel. An annual flu vaccine is the best protection for you and your loved ones. Simple steps like staying home when sick and improving ventilation can also reduce spread. If you're unsure, testing helps clarify what you're dealing with so you can take the right next steps. Next, RSV. Especially important for families with infants, older adults, or anyone with lung disease. 1. RSV, respiratory syncytial virus. Symptoms: runny nose, cough, wheezing, fever, and trouble breathing. There's no specific cure. Treatment is mostly supportive care. Severe cases may require oxygen or hospitalization. RSV is diagnosed with PCR or antigen tests from a nasal swab. RSV cases tend to surge around the holidays when families gather indoors. Hand hygiene and staying away if you're sick can help protect babies and high-risk loved ones. If you notice fast or difficult breathing in an infant, seek medical advice promptly. Now, COVID-19, still with us, and often rising in colder months. 1. COVID-19. Symptoms include fever or chills, cough, shortness of breath, fatigue, congestion or sore throat, and muscle aches. High-risk patients may qualify for antivirals like Paxlovid, while most people recover with rest and hydration. You can use at-home rapid tests or PCR tests for confirmation. If you're visiting elderly relatives, testing before gatherings can help protect them. If you feel sick, skip events and follow guidance to prevent spread. Testing remains a key tool to reduce transmission during the holidays. A quick test before seeing high-risk loved ones is a small step with big impact. Next, Norovirus, often called the stomach flu, and it spreads incredibly fast. 1. Norovirus, the stomach flu. Symptoms: sudden nausea, vomiting, diarrhea, stomach cramps, and a low-grade fever. There's no medication to cure norovirus. Treatment is hydration and rest. Stool tests can confirm it in medical settings. Hand sanitizer does not kill norovirus. Soap and water are your best defense. Wash thoroughly, especially after using the bathroom and before preparing food. Simple hygiene steps can drastically cut down household spread. Finally, measles. Rare in most communities, but extremely contagious where vaccination rates are low. 1-1. Measles. Measles spreads faster than almost any other virus. Vaccination is critical. Symptoms: high fever, cough, runny nose, red eyes, and a rash that spreads from the face downward. PCR testing and blood antibody tests are used to confirm measles. There's no antiviral cure. Supportive care, and sometimes vitamin A. Measles is almost entirely preventable through the MMR vaccine, which is safe and highly effective. Ensure you and your children are up to date with MMR shots. Let's finish with simple steps to stay well this season. Stay up to date on flu, COVID-19, RSV, if eligible, and MMR vaccines. Wash hands with soap and water, especially before eating and after travel. Mask if you're sick, traveling, or visiting high-risk loved ones. Early testing helps guide treatment and protects others. Skipping one gathering can prevent many infections. Vaccination is your strongest layer. Check if you're due for a flu shot, COVID-19 booster, or MMR. Hand hygiene matters most after coughing, after the bathroom, and before preparing food. Avoid touching your eyes, nose, and mouth. It's a common entry point for germs. Improve airflow indoors. A little fresh air goes a long way. In tight spaces like buses or trains, a well-fitting mask adds protection. Consider a quick test before seeing high-risk loved ones. Together, these steps create layers of protection for a healthier holiday season. The holidays should be about connection, not infection. Knowledge is power, and small steps can make a big difference in keeping your family safe and healthy. If you found this helpful, subscribe to Arcpoint Labs on YouTube for more helpful hands and facts on health, safety, and wellness, especially during busy seasons like the holidays. Share this video with someone you care about, and we'll see you in the next one. Stay safe, stay healthy, vaccinate, wash hands, mask smartly, test when sick, and stay home if ill. From all of us at Arcpoint Labs, wishing you a happy, healthy holiday season. Thanks for watching.